Hello everyone, I'm Daisuke Hihara at Toho University Ohashi Hospital, Tokyo, Japan.
And I'm Hiroyuki Takamaru at National Cancer Center Hospital, Tokyo, Japan.
Thank you so much for inviting us for this interview. We would like to talk about our original article, which was recently published in JIE called Factors Associated with Increasing Duration of Endoscopic Submucosal Dissection for Rectal Tumors, a 22-year retrospective analysis. First, I'd like to acknowledge the contributions of Dr. Saito, Dr. Sekiguchi, Dr. Yamada, Dr. Sakamoto, and Dr. Matsuda.
Thank you, Dr. Hihara. In this manuscript, you analyze the risk factors regarding prolonged rectal ESD. First, I would like to ask you, why did you decide to investigate this issue?
Yes, it is because the colorectal ESD is widely used in recent years. However, we still experience technically challenging regions. Of course, rectal ESD is considered a first step of colorectal ESD training because endoscopic maneuvers are easier, and perforation rarely causes pamperitoneitis due to rectal anatomical features. Nevertheless, some rectal regions require a long procedure time than usual, and the reason for the prolonged time taken for these specific regions remains unclear. Therefore, we investigate our rectal ESD to clarify the factors associated with prolonged procedure time.
Thank you very much. You had defined the long-term rectal ESD as a procedure of more than 120 minutes. Why did you set this definition?
We defined prolonged ESD as ESD with a procedure time of more than 120 minutes, according to previous studies that reported the mean ESD procedure time as 52 to 86 minutes, range 49 to 190 minutes, while average time ESD was defined as ESD with a procedure time of less than 120 minutes.
I understand. Please read the next question. Would you tell us the keys of your study?
This study analyzed factors associated with longer procedure time for ESD, predicting the possibility longer procedure time is clinically important to guide appropriate scheduling of the procedure duration. This study found several factors such as the location of the region involving the anal canal, the section size 50 mm or more, circumferential range 2 cells or more, and invasion depth T1b or more as the independent risk factors for the excessive rectal ESD durations. Overall, 144 and 339 regions were resected using prolonged and average time ESD respectively. The mean procedure time was 203 and 79 minutes respectively. Univariate analysis showed that tumor location in the lower rectum involving the dentate line, the section size 50 mm or more, and circumferential range 2 cells or more were risk factors for prolonged ESD. Finally, multivariate analysis reveals the factors previously I explained.
Thank you for detailed explanations. Could you tell me how the factors are used in daily practice? For example, when you perform ESD for patient estimated a longer procedure, what will you prepare for?
Rectal ESD is appropriate for the introduction of colorectal ESD. However, when rectal lesions with risk factors are presented above, careful management is necessary because ESD may be prolonged. For example, it is possible to provide efficient medical care by preparing a supervisor and securing a long operation time in advance.
I think it is an important point, especially if the hospital newly introduced the colorectal ESD procedure. Yes, final question. How did you develop this study in the future?
Since this is a retrospective single-center study, the possibility of potential selection bias cannot be ruled out. To fully adjust the covariate that might affect the outcome, a large number of cases would be required, or we would have to conduct a randomized control trial to avoid selection bias. A prospective trial may be desirable to verify these results as a next step for our study. Thank you for your kind attention.